Hey everyone, and welcome to the Deep Dive. Today we're going to be exploring eHealth.
Oh, exciting.
Yeah, where healthcare and technology collide.
I love it.
So get ready for, I think it's going to be a pretty fascinating discussion.
Yeah, definitely.
Think about things like getting your blood oxygen levels checked just with a simple finger sensor,
Wow.
and that data going straight to your doctor.
Amazing.
Or managing all your health data from appointments to lab results right on your smartphone.
So convenient.
I know that's the power of eHealth, and we've got a lot to unpack today.
Definitely.
So huge thanks to London Heartbeats Z Academy in the UK for providing the material for this deep dive.
They're great.
And make sure you subscribe to their channels on Facebook, Instagram, Spotify, and YouTube.
Yeah, for more awesome content.
Now, I've got an expert here with me today who can help us break down all these complex concepts.
Well, I'll try my best.
So let's start with the basics. What exactly is eHealth?
Well, eHealth really covers a whole bunch of different applications, from electronic health records to telemedicine platforms, patient portals, and even tools for providers to learn online.
Oh, wow.
Yeah, so it's really all about using those information and communication technologies, or ICT,
Right.
to make healthcare better,
Mhm.
improve access to it, and ultimately get better outcomes for everybody.
So it's a lot more than just like doing a virtual doctor's appointment on Zoom.
Oh, yeah, definitely. eHealth can be broadly split into two main categories.
Okay.
You've got telehealth and non-telehealth.
Got it.
Telehealth is all about those interactions that happen remotely, like virtual consultations and remote monitoring of patients.
Right.
And then non-telehealth things like providers using ICT for learning supporting surgeries, even enhancing things like endoscopy.
Sounds like there's a whole world of possibilities within those
Oh,
categories.
there really is. And within each category, you'll find different types of interactions happening too.
Like what?
Well, you've got provider-to-provider communication, for example, where doctors can remotely consult with specialists, share patient information securely, and work together on treatment plans all in real time.
Wow. So that would really streamline things.
It does. It can really help with coordinated care.
That's amazing.
And then there's patient-provider interaction, which is probably what most people think of first.
Right, like when we think of telemedicine.
Exactly. Things like remote patient monitoring.
Yeah.
Where someone with a chronic condition might use a wearable device to track their vitals,
Okay.
and that data is sent straight to their healthcare team.
Oh, wow. That's incredible.
It can be a game changer, particularly for managing chronic conditions.
Absolutely. So what other kind of patient-provider interactions fall under that eHealth umbrella?
Well, there are the virtual consultations that we mentioned, where
Right.
patients can have appointments with their doctor through video conferencing.
Right.
And that can save so much time and hassle, especially for folks in rural areas or those who have trouble getting around.
That makes a lot of sense.
Yeah.
Yeah, it would definitely make healthcare more accessible to so many people.
Exactly.
But with all this digital information flying around, what about patient privacy?
Oh, that's absolutely crucial. And it's a major focus as we develop and implement these e-health technologies.
Okay.
We're talking about electronic patient records, EPRs,
Right.
which can hold so much personal and very detailed health information. So protecting that data is paramount.
Definitely. So how do we make sure that all that sensitive information stays protected in this digital world?
Well, standardization and interoperability are really key here.
Oh.
We need to ensure that all these different healthcare systems can talk to each other, and exchange information seamlessly and securely.
That makes sense.
This means using consistent coding schemes and sticking to international medical standards.
Sounds like everyone's speaking the same language when it comes to healthcare data.
Precisely. And if everyone's using different systems that can't communicate, it just creates chaos. And that's when patient data could be at risk.
Right. Yeah, that makes a lot of sense.
And that's where health information exchange, or HIE systems, come in.
Okay. What is it?
They're basically secure platforms that make it easier to transfer health data between different organizations.
So like a secure network designed specifically for sharing health information.
Exactly.
I see, with the right systems in place, eHealth really does have the potential to revolutionize the way we access and manage our health information.
It really does.
But let's talk about a specific area of eHealth that's been really taking off lately.
Okay.
Health or mobile health.
Oh, yes. mHealth is fascinating.
It is. So tell us more about it.
Well, it's basically a part of eHealth that focuses on using mobile devices like smartphones and tablets.
Right.
And it opens up so many amazing opportunities for collecting health data, delivering healthcare information, and even providing real-time monitoring and care, all from our fingertips.
That's incredible. So what are some ways that mHealth is being used today?
Well, think about mobile telemedicine devices.
Okay.
They allow patients to have virtual visits with their doctor from anywhere with an internet connection.
Wow.
And then you've got things like MP3 players being used from learning. So patients can access educational materials about their conditions wherever they are.
That's brilliant. It's like putting healthcare right in people's pockets.
Exactly. And the health ecosystem is so diverse.
In what way?
Well, it involves developers, branding agencies, content specialists, legal experts, and of course the patients themselves.
Wow. It really does take a village.
It does, and it's amazing to see how this technology is evolving to meet the needs of all these different stakeholders.
So we've come a long way from those early standalone apps with limited functionality.
We really have. Now we've got these interconnected systems that can talk to each other and share information securely and in a standardized way.
It's amazing how far we've come.
It really is. It's a testament to the power of innovation in healthcare.
It is. So let's fast forward for a second and imagine a future
Right.
where eHealth is fully realized. What does that world look like? What kind of impact could it have on the healthcare system as a whole?
Imagine a completely wired healthcare system that connects everyone involved.
Wow. Everyone.
Yeah, primary care physicians, labs, pharmacies, specialists, academic medical centers, government agencies, and of course the patients themselves.
Wow, that's a big network.
It is. It's a vision of seamless collaboration and data sharing that could truly revolutionize healthcare.
I can only imagine. So that would obviously have a huge impact on community workflow and patient engagement.
We'd see a shift towards more digital processes, better communication between healthcare professionals, and ultimately more efficient and effective care.
And what about the patients themselves? How would their experience change?
Well, they would become much more active participants in their own care. They'd have access to their own personalized health information and new ways to connect with their healthcare providers.
That's amazing. It sounds like eHealth could really empower patients and improve their overall experience.
Absolutely. And with all this data flowing through the system, we'd also get valuable insights into population health trends.
Oh, that's interesting.
Yeah, we could spot potential outbreaks early on, track the progression of chronic diseases more effectively, and develop targeted interventions to improve public health outcomes.
So eHealth could help us understand and manage health at a population level.
Precisely.
That's incredible. And this isn't just some futuristic fantasy, is it? There are actual eHealth initiatives happening around the world right now.
Oh, there absolutely are. We're seeing national e-health programs gaining traction all over in Europe, Asia, Pacific North America, the Middle East, and South America.
Wow. It's truly a global movement.
It is, and the global e-health economy is booming.
So this is more than just a trend. It's a fundamental shift in the way healthcare is being delivered.
I think so.
This is really exciting to see. But let's be realistic for a second. eHealth isn't a guaranteed success story, right? There are bound to be challenges along the way.
Oh, you're absolutely right. And one of the biggest challenges is funding.
Of course, developing and implementing these eHealth initiatives requires a lot of investment.
It does, and it needs to be ongoing to maintain them as well.
That makes sense. We need to make sure we have the resources to build and sustain these complex systems.
Absolutely.
So what other challenges might we face?
Well, another common one is unclear governance.
Okay.
If there's no clear leadership or shared vision, e-health projects can quickly become bogged down, conflicting priorities, lack of direction.
Right, it's like trying to build a house without a blueprint.
Exactly.
So strong leadership and a unified vision are key.
They are.
And of course, we can't forget about standardization and interoperability, which we talked about earlier.
Definitely, if different systems can't communicate, it defeats the whole purpose of having a connected healthcare system.
Exactly. And you mentioned that achieving true interoperability can be a major hurdle.
Oh, it takes meticulous planning collaboration between different stakeholders, and everyone needs to be on board with established standards.
It sounds like a delicate balancing act.
It is, it really is, and communication is key too.
Of course.
We need to make sure everyone understands the need for and the benefits of e-health.
Right, patients, providers, policymakers, the general public, everyone.
Everyone. It's about building trust and making sure people see the value.
Absolutely. So we've got funding, governance, standardization, interoperability, and communication. Those are all crucial.
They are.
Are there any other potential pitfalls we should be aware of?
One more that's worth mentioning is underestimating the cultural and social context.
Interesting. What do you mean by that?
Well, e-health initiatives need to be sensitive to local culture, values, and beliefs. What works in one country or one setting might not be appropriate or effective in another.
Right. So it's about understanding people and adapting technology to fit their specific needs.
Exactly. It's not just about the technology itself. It's about empathy and cultural sensitivity.
It sounds like eHealth is about using technology to make people's lives better,
Exactly.
and that requires a deep understanding of their needs and aspirations.
I completely agree.
This has been an incredible journey so far. We've covered so much ground in just this first part of our eHealth deep dive, from the basic definitions and classifications to the world of telemedicine, mHealth, and that vision of a wired healthcare future.
It's been great.
We've laid the groundwork for what I think will be a fascinating discussion.
Yeah, definitely.
Now, before we move on to part two, I want to again thank London Heartbeat's Z Academy in the UK for providing us with this incredible material. Their work is truly making a difference in the world of eHealth.
It is. They're a fantastic resource.
So be sure to check out their amazing work. You can find them on Facebook, Instagram, Spotify, and YouTube.
Definitely do that.
And to all our listeners, be sure to join us for part two, where we'll continue to explore eHealth and delve even deeper into its transformative potential.
Looking forward to it.
See you there.
Bye. Welcome back to our deep dive into eHealth.
Yeah, in part one, we laid a pretty solid foundation, I think, and now I'm really excited to explore some of those real-world applications, and see how eHealth is actually making a difference in people's lives.
Definitely. So let's revisit that idea of a wired healthcare future.
Okay?
Remember we talked about that a bit earlier?
Right.
Imagine a world where patients have instant access to all their medical records.
Wow.
They can schedule appointments online, get those personalized health reminders.
That sounds so convenient.
It is, right? No more waiting on hold or trying to find those old test results.
Yeah, no more digging through filing cabinets.
Exactly. And for healthcare providers, well, think about having all of a patient's information right at your fingertips, their medical history, their medications, allergies.
That would streamline things so much.
It can really help reduce errors, too.
Definitely. And what about chronic disease management?
Oh, that's a huge area where this could make a big impact.
How so?
Well, patients with conditions like diabetes or heart disease, they could use wearable devices to track their vital signs and share that data with their doctors in real time.
So the doctors could basically monitor their patient's progress remotely.
Exactly, and intervene if needed,
Mm-hmm.
preventing those complications and improving outcomes. Wow, that's amazing.
And of course, we can't forget about remote consultations.
Right.
A specialist in a big city could provide their expertise to patients in rural areas.
Right. Who might not otherwise have access to that level of care.
Exactly. It's breaking down those geographical barriers.
That's incredible, bringing specialized care to those who need it most.
And it's happening now.
Good.
Oh, yeah. We're seeing telemedicine programs being implemented all over the world.
That's so exciting, connecting patients and providers in ways we never thought possible.
It really is. So do you want to hear some specific examples?
Yeah, I'd love to hear about some real-world applications.
Okay, well, there's this program in a remote region of Alaska,
Okay.
and they're using telemedicine to provide prenatal care to pregnant women
Wow,
who would otherwise have to travel hundreds of miles for appointments.
that's incredible.
It's truly life-changing. And what about eHealth? Do you remember we talked about that?
Yeah, the mobile health stuff. Well, there's this project in India that's using mobile phones to deliver health education and support to new mothers,
Oh, why?
helping them learn about breastfeeding, nutrition, infant care.
That's such a great use of technology.
It is. It's reaching people where they are and giving them the knowledge they need.
Right, empowering them.
Exactly. And these are just a couple of examples.
I bet.
The applications of eHealth are really limitless. We're just scratching the surface here.
It's so exciting, but also a little daunting to think about all the possibilities and the challenges.
Yeah, there's a lot to consider.
For sure. So we've discussed things like funding, governance, interoperability, but there's another challenge I want to explore a bit further.
Okay, what's that?
The digital divide.
Ah, yes, the digital divide.
Can you explain what that means exactly?
So the digital divide refers to that gap between those who have access to technology and those who don't.
Right.
And this gap can be due to a lot of different things. Income, education, geographic location, age.
So in the context of eHealth, are you saying that not everyone has equal access to the benefits of these technologies?
Exactly. If we're not careful, eHealth could actually make existing health disparities even worse.
Oh, no.
Yeah, it's a risk we need to be aware of.
So it could create a two-tiered healthcare system.
It could, where those with resources and tech skills have a real advantage.
That's a really concerning thought.
It is. So we need to ask ourselves, what steps can we take to bridge this digital divide and make sure eHealth benefits everyone?
Right, not just a select few. What can we do?
Well, it's a complex issue, and there's no easy solution.
I figured as much.
It requires a multifaceted approach that looks at the root causes of the digital divide.
The social and economic factors.
Exactly. So it's not just about providing access to technology, but also making sure people have the skills and resources to use it effectively.
So investing in digital literacy programs.
Yes, providing affordable internet access.
Right.
And designing e-health solutions that are user-friendly and accessible to people of all ages and abilities.
It's a big challenge.
It is, but we can't ignore it.
We can't if we want eHealth to truly live up to its promise.
I completely agree. The success of e-health depends on bridging that digital divide.
Making sure everyone has the chance to benefit.
Exactly.
So as we continue exploring eHealth, I'm curious to hear your thoughts on artificial intelligence.
AI.
Yeah, it seems like it's going to play an even bigger role in healthcare in the coming years.
Oh, absolutely. AI is already making waves in areas like medical imaging, drug discovery, personalized medicine.
Right.
And its potential applications in eHealth are huge.
I can only imagine. What do you think the future of eHealth might look like with AI at the helm?
Okay, well, imagine virtual assistants powered by AI.
Interesting.
They can answer your health questions, schedule your appointments, even provide some basic medical advice.
That sounds like something out of a sci-fi movie.
It does, right? Are we really that close to having AI doctors?
That's the question.
Well, AI is unlikely to replace human doctors anytime soon, at least not completely. But it can definitely help them be more efficient and provide better care.
So AI could be a valuable tool for healthcare professionals.
Absolutely, helping them make better decisions and streamline their work.
How so?
Well, AI can analyze huge amounts of data, identify patterns, make predictions that would be impossible for humans to do on their own.
Wow, that's powerful stuff.
It is so. Can you think of some specific examples of how AI is being used in eHealth today?
Well, I've heard about those AI-powered chatbots
Yes,
that can interact with patients, answer questions, and provide personalized health information,
exactly. Those chatbots could act as virtual health assistants.
guiding patients through their healthcare journey.
Exactly. They could even help triage patients,
Yeah.
direct them to the appropriate level of care.
Saving time and resources.
Exactly.
That's a really clever application of AI.
It is. And another exciting area is predictive analytics.
Okay.
Using AI algorithms to analyze patient data and identify individuals who might be at risk for developing certain conditions.
Wow. So we could intervene early and focus on prevention.
Exactly, shifting from a reactive approach to a more proactive one.
That's amazing. And I know AI can also play a role in personalized medicine.
Absolutely, tailoring treatments to individual patients based on their genes and lifestyle.
It seems like AI has the potential to revolutionize healthcare in so many ways.
It really does. The possibilities are incredible. But as with any powerful technology, we need to be careful.
Right. There are ethical considerations.
Definitely. So, what are some of the ethical concerns surrounding AI in healthcare?
One that comes to mind is bias in AI algorithms.
Yes, that's a big one.
If they're trained on biased data, they could make things worse.
Exactly. They could perpetuate and even amplify existing inequalities in healthcare.
Give me an example.
Well, let's say an algorithm is used to predict the risk of heart disease,
Okay.
but it was trained on data that reflects historical biases in healthcare delivery.
Right. So it might unintentionally discriminate against certain racial or ethnic groups.
Exactly.
We need to be so careful about the data used to train these algorithms.
We do, and we also need to make sure AI is used responsibly and ethically when it comes to clinical decision-making.
So AI should be a tool to support human judgment.
Exactly, not replace it.
Right. So it's all about finding that balance.
It is.
Leveraging the power of AI while still preserving that human touch.
Yes, and transparency is key too.
Of course, patients need to know if AI is being used in their care.
Right, and they need to understand how those decisions are being made.
We don't want those black box algorithms.
No, we need transparency and explainability so we can build trust.
Absolutely. So patients feel comfortable with the use of AI in their healthcare.
Exactly. And accountability is important too.
How so?
We need clear guidelines and regulations for the development and use of AI in healthcare.
To make sure it's being used safely, effectively, and ethically.
Precisely.
Seems like we're entering a whole new era of healthcare.
I think we are.
Technology is becoming more and more integral.
It is. And as we embrace these possibilities of eHealth and AI, we need to proceed with caution and a strong sense of responsibility. I agree it's an exciting time, but we need to make sure these powerful tools are being used to create a more equitable, accessible, and ethical healthcare system for everyone.
So this has been a really eye-opening look at eHealth so far.
It has.
We've talked about so much from the basic concepts to the potential benefits and challenges, and of course, those important ethical considerations.
It's been a great discussion.
It has. I hope our listeners have a better understanding of this rapidly evolving field now.
I hope so too.
And before we move on to the final part of our deep dive, I want to again thank London Heartbeats Academy in the UK for providing us with such insightful material.
They're doing great work.
Their work is really invaluable for anyone who wants to understand this complex world of eHealth.
I agree.
So be sure to check out their website and social media channels for more information. You can find them on Facebook, Instagram, Spotify, and YouTube.
Definitely do that.
And for our listeners, be sure to join us for Part 3, where we'll delve into the ethical considerations of eHealth and explore the role of AI in shaping the future of healthcare.
Sounds good.
Welcome back to the Deep Dive.
Yep.
In Parts 1 and 2, we've really journeyed through this exciting world of eHealth.
It's been quite the journey.
It has exploring, its potential to really transform how we think about healthcare.
Definitely.
But like with any powerful tool,
Right.
we need to consider those ethical implications.
Absolutely.
So in this final part, let's dive into some of those important considerations.
Let's do it.
So one of the most pressing concerns is patient privacy, right?
Of course.
With so much sensitive health data being collected, stored, and shared electronically, how can we be sure that it's protected and used responsibly?
It's a huge question.
It is.
The protection of patient privacy has to be paramount in eHealth.
Right.
We need to have really robust security measures in place to protect electronic health records.
From things like...
Well, unauthorized access, data breaches, and misuse.
Right, so we need kind of a multi-layered approach to security.
Exactly. Things like encryption access controls and really strict data governance policies.
It's not just about the technology, though, is it?
No, it's not. It's about creating a culture of privacy and responsibility among healthcare providers and everyone who handles that sensitive patient data.
So everyone involved in the eHealth ecosystem needs to understand the importance of data privacy.
Yes, and follow those best practices to protect patient information.
And transparency is crucial, too, right?
Absolutely. Patients should be informed about how their data is being used.
Right, and they should have control over who has access to it.
Exactly. It's about empowering patients and making sure they feel confident and in control of their own health data.
It all comes down to trust, doesn't it?
It really does.
We've talked a lot about how eHealth can improve access to care, but there's also that risk that it could make existing health disparities worse.
That's right. We need to be very mindful of the digital divide.
Right.
And ensure that these eHealth solutions are accessible to everyone.
Regardless of...
Socioeconomic status, geographic location, or their level of technological literacy.
So it's not just about, developing cutting-edge technology.
Yeah, it's not.
It's about making sure that everyone can actually use it.
Exactly.
So how do we bridge that digital divide?
Well, we can start by providing affordable internet access, investing in those digital literacy programs, and designing eHealth solutions that are user-friendly.
So that they're accessible to people of all ages and abilities.
Precisely. We need to approach eHealth implementation with a focus on equity and inclusivity.
And if we do that...
If we do that, then we can harness that transformative power of eHealth and make sure it benefits everyone.
Everyone, not just a select few.
Exactly.
Now, we've touched on the role of artificial intelligence in eHealth throughout our deep dive.
We have AI is definitely a hot topic.
It is. It seems like it has so much promise, but also raises some ethical questions.
It does. It's a powerful tool, but we need to consider those ethical implications.
So what are some of the concerns surrounding AI in healthcare?
Well, one of the biggest ones is bias in the algorithms.
Right.
If those algorithms are trained on biased data, they can actually perpetuate and even amplify existing inequalities in healthcare.
So give me an example.
Okay, so imagine an algorithm used to predict the risk of heart disease.
Okay.
If it's trained on data that reflects historical biases in healthcare delivery, it might unintentionally discriminate against certain racial or ethnic groups.
Wow, that's a scary thought.
It is. So we need to make sure that the data used to train these AI algorithms is representative and inclusive.
And constantly monitor for and mitigate any potential bias.
Exactly. We also need to make sure that AI is used responsibly and ethically in clinical decision-making.
So AI should be there to support human judgment and expertise, not replace it entirely.
Absolutely. It's about finding that right balance.
Right, leveraging the power of AI while preserving that human element in healthcare.
Exactly, and transparency is key too.
Of course.
Patients should know if AI is being used in their care and understand how those decisions are being made.
We don't want those black box algorithms.
We need transparency and explainability so we can build trust.
Exactly, so patients feel comfortable with AI being used in their healthcare.
Precisely, and accountability is crucial too.
In what way?
We need clear guidelines and regulations for the development and use of AI in healthcare to make sure it's being used safely, effectively, and ethically.
It seems like we're entering a whole new era of healthcare,
I think we are.
where technology plays an even bigger role than ever before.
It does, and as we embrace the possibilities of eHealth and AI,
Right.
we need to move forward with enthusiasm, but also a deep sense of responsibility.
To ensure that we're using these tools to create a more equitable, accessible, and ethical healthcare system for everyone.
Exactly. For everyone.
This has been a truly eye-opening deep dive into the world of eHealth.
I've enjoyed it.
Me too. We've covered so much from the basic concepts to the potential benefits and challenges and those really important ethical considerations.
It's been a great discussion.
And before we wrap up, I want to thank London Heartbeat's C Academy in the UK once again for providing such insightful material.
They're a fantastic resource.
Their work is truly making a difference in the world of eHealth education.
It really is.
Be sure to check out their website and social media channels for more information. You can find them on Facebook, Instagram, Spotify, and YouTube.
Definitely do that.
And to our listeners, thank you so much for joining us on this incredible journey into the future of healthcare.
We hope you've enjoyed it.
We encourage you to continue exploring this fascinating world of eHealth.
It's a world full of possibilities.
It is. Until next time, stay curious and keep exploring.
Bye, everyone.